Dimitriadi. I'm one of the cosmetic gynecologists in Center for Surgery. We have the most amazing female gynecology team. We have pre-op and post-op nurses, we have theatre nurses, we have recovery nurses, and obviously me. We offer a variety of procedures, surgical and non-surgical. The most popular procedure nowadays is labioplasty. The non-surgical procedures are with photon laser, when we can improve vaginal laxity, bladder dysfunction, and uterine wall prolapse. We rejuvenate the collagen and we improve the symptoms. We offer also surgical procedures, vaginoplasty, that is to improve vaginal laxity as well as to treat vaginal laxity, as well as to improve of symptoms and complications after childbirth, as well as to correct vaginal wall prolapse, cystosil and rectosil. And we do also labioplasty, that is to refine and reshape labia minora and majora. So it's very common procedure nowadays, and have done hundreds the last few years. I work with the Center for Surgery. We all have a female gynecology team with pre-op and post-op nurses, and obviously me. So obviously having excess skin on the labia minora and majora is something very normal, so everybody has its own anatomy. It's just what we want to change and improve our confidence and our comfort with our daily activities. So together we can discuss what the plan will be, how much tissue we can remove, and people are afraid of losing sensation during sexual intercourse after having labioplasty. So this is one of the main reasons of people postpone labioplasty. But honestly, we have very good results with that. We don't go anywhere around the clitoris, we don't do any stitches around the clitoris, and we are very careful with female anatomy, as well as we have very natural results, like we have no scars and not any evidence of a previous procedure in the area. Risks and benefits of every procedure we can discuss during our consultation. Plan will also be discussed. Risks of labioplasty is risk of infection. Obviously, it is a risk for every procedure, but we can always minimize that risk by giving a prophylactic course of antibiotics and giving you a lot of hygiene advice that you can follow after labioplasty. Risk of having scar and the risk of having loose cessation during sexual intercourse. That is one of the risks that the ladies are afraid of having a labioplasty. But honestly, we have very good results and very good feedback from our ladies that they have the same cessation after labioplasty, or even more cessation, because we have removed the excess skin that covers the clitoris. There are many ladies that they come to visit us when they had a labioplasty abroad, and they have a very bad outcome, either with a bad scar, uneven skin edges, or a loss cessation during sexual intercourse. Obviously, the years experience I have in female anatomy puts me in a position that we avoided certain positions during labioplasty, especially around the clitoris. We don't go anywhere there, we don't put any stitches around there. And the way of repairing the tissue allows the natural healing. So I just repair the tissue from inside out. So that's the natural way of healing. I don't do interrupted stitches, so all the stitches will be hiding inside and will be fully absorbed from the body. In that way, we avoid any uneven skin edges, like my fist is like very typical. Like when we do interrupted stitches, then we create automatically like very uneven skin edges. So I personally go from inside out. You don't have any obvious knots at the end of the procedure, and the final knot will be on the bottom part of the labia. That is hiding inside the skin. So the body after 3-4 weeks will fully absorb the stitches, and you'll have a very, very nice natural looking labia without scars and without any asymmetry.